is NCLEX RN multiple choice questions. Question 1. Set 1. A patient is hearing voices that say, kill yourself. What should the nurse ask first? How long have you heard these voices? Do you have a plan to carry this out? Why do you think the voices say that? Would you like some medication? Assessing for safety and a specific suicide plan is the priority when a patient reports command hallucinations. Question 2. Set 2. A mother is Rh negative and her baby is Rh positive. When should she receive RhoGAM? At 28 weeks and within 72 hours of delivery. Only at delivery. Only if she has a second child. At every prenatal visit. RhoGAM is given to prevent isoimmunization in Rh negative mothers. Question 3. Set 3. Which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 4. Set 4. What is the antidote for heparin overdose? Vitamin K, protamine sulfate, naloxone, acetylcysteine. Protamine sulfate neutralizes the effects of heparin. Question 5. Set 5. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 6. Set 6. A client has a chest tube. The nurse notes continuous bubbling in the water seal chamber. What does this indicate? Normal function. An air leak. The lung has expanded. The tube is occluded. Continuous bubbling in the water seal chamber indicates a leak in the system. Question 7. Set 7. Which sign indicates a potential complication of a thyroidectomy? Sore throat, laryngeal stridor, fatigue, dry skin. Stridor indicates airway obstruction, possibly from edema or nerve damage post-thyroidectomy. Question 8. Set 8. A patient is post-bronchoscopy. What is the nurse's priority assessment? Pain level, gag reflex, urinary output, blood pressure. The gag reflex must return before the patient can safely eat or drink to prevent aspiration. Question 9. Set 9. What is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 10. Set 10. Which is a characteristic of croup? Productive cough, barking, seal-like cough, wheezing on expiration, high fever. Croup is characterized by a distinctive barking cough caused by laryngeal edema. Question 11. Set 11. Which condition is characterized by currant jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease? Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 12. Set 12. Which lab value is elevated in acute pancreatitis? Serum amylase, BUN, hemoglobin, potassium. Serum amylase and lipase are significantly elevated in acute pancreatitis. Question 13. Set 13. Which is a common side effect of radiation therapy to the head and neck? Diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 14. Set 14. What is the golden hour in newborn care? The first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 15. Set 15. A patient is taking warfarin. Which lab value should be monitored? APTT, point/INR, platelets, WBC. Point/INR is used to monitor warfarin, Coumadin, therapy. Question 16. Set 16. What is the priority when a patient falls? Complete an incident report, notify the physician, assess the patient for injury, move the patient back to bed. Assessment of the patient's condition is always the first priority after a fall. Question 17. Set 17. What is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 18. Set 18. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 19. Set 19. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 20. Set 20. A patient with heart failure is prescribed digoxin. Which finding should the nurse report immediately? Heart rate of 72 bpm, visual disturbances like seeing yellow halos, increased urine output, blood pressure of 120/80 mmHg. Yellow halos are a classic sign of digoxin toxicity.